I think there's a lot of narrative, especially among the startup community. I don't know if it's like the TED Talks or the type of founders that we idolize, but there's like a lot of just bad advice out there for founders. And what
Okay.
I mean by that is like when you build a business, you learn that it's about like being a good leader and like building a company is learning what you can ignore.
All right, welcome everyone to episode 20 of How Would You Build It? Made the 20 mark, and on that note, welcome, Mark.
Cool. Thanks for having me. Let's do this.
I think to set us going, can you just share your current startup, which is Ollie Health? Give us the elevator pitch of what you guys do.
Oh, elevator pitch. Okay. Mental health credits for global companies. So we've created a mental health currency, which basically allows employees from anywhere around the world to have these live sessions. So group therapy, private therapy, it's fully anonymous. We're trying to make, whether you're a freelancer, a CEO, a contractor at a company, we're trying to make mental health support something that's real. We kind of, we're going after the EAPs. I don't know if you know what an EAP is,
No,
by
please
the way.
share. Even if I don't, the listeners will know, all need to know.
Cool. No, you're in tech and you have a podcast. So I'm pretty sure you didn't know what an EAP was. But if you work at Deloitte or EY or another big company in South Africa, you probably definitely know what it is. It's
Okay.
basically an employee assistance program. And what
Okay,
that
of course.
means is, yeah, you get access to support, emotional support. And they're kind of these traditional, we call them like duct tape type solutions where companies kind of know that they have to have something in place. So they tick a box, they'll have
Mm,
these programs. But the kind of dirty little secret is that, less than 20% of, staff even know that they have access to it, never mind use it. So,
mm.
we're basically trying to revive that in the sense that, if we can prove that, supporting your team's mental health can improve growth as a team, save you cost on employee churn,
Mm.
and create a better team culture performance, then yeah, then that's we've done our job there.
Yeah. Well, awesome. I must say there's been a trend. So I've obviously been working for a good couple of years now, and I feel like in the last, I don't know, I'll give it a couple of years now, but let's say around 10 years, I've definitely seen a trend where these EAPs, as you call it, did I say it right? EAP? Yes. They've become quite a popular thing that companies are providing. And I think what's super interesting is actually seeing that Ollie Health started in 2020. And I mean, mental health in 2020 was definitely things that people were talking about. Did you have this idea beforehand, or can you just say how, maybe it had a catalyst effect considering what was happening around 2020?
Yeah, I think to set the context, maybe sort of how I got to, I guess, starting a company and why, and I guess why you'd be crazy enough to try build a company. Yeah, I kind of got started into working in tech and startups pretty early. I was a Stellenbosch student dropout. I lasted all of 3 months. I went down the traditional route of trying to impress my dad with a degree that I didn't want to do, which was law. As you do when you're
Mm-hmm.
18 and you have
Yeah,
zero understanding of what you want out of anything.
true.
So I followed that path. And, at the same time, I was kind of lucky in the sense where I always had an interest in tech and like building like just little platforms, and was kind of teaching myself very basic like development at the time
Mm.
through a couple like Udemy courses. And that's kind of how I had a plan B after I dropped out. I didn't tell my parents. I dropped out of university. I started hacking around as you do. And yeah, sort of that's how I found my way into a startup in Stellenbosch called Quench, which was we were kind of the first people to have like a 24-hour liquor license in the country. We were delivering alcohol to thirsty students at all hours of the night and mornings. Let's just say that was
A good
we found
business?
product market fit pretty early, and it's kind of yeah, if
No
there's
surprise
anything
there.
that students will buy and know how to do well is drink and spend money on, it's alcohol. So I mean, we kind of we jumped in head first. We made every single mistake kind of
Mm.
21-year-old founder would make. But got to learn, basically, it was like an MBA in a year.
Mm.
And we scaled that pretty fast. And that was kind of my entrance into startups, tech. Um, Also understanding that there's certain like inflection points. I think there's a lot of narrative, especially among the startup community. I don't know if it's like the TED Talks or the type of founders that we idolize, but there's like a lot of just bad advice out there for founders. And what
Okay.
I mean by that is like when you build a business, you learn that it's about like being a good leader and like building a company is learning what you can ignore. And like a lot of it's just bad advice. Like, find one marketing channel and stick to that and own that first. I mean, that's just terrible advice because it's absolutely terrible advice. And I'll tell you why, because essentially like you need to go out and figure out what game you're going to play, right? Is it
Mm-hmm.
B2B or is it B2C? And where those people are. Like we were playing a B2C game. And like if you understand that that's the game that you're going to play, that requires certain rules to that game. Like you're going to have high burn because you're going to have to advertise, getting users
Constantly.
and app downloads super expensive. What's your basket size that you're going to sell? Okay, if we're selling 250 rands worth of beers, okay, that's a good amount, but that's a once-off purchase. That's not like a
Mm.
monthly subscription, right? So there's going to be a lot of churn. Like, how do we get that customer back?
And the
Versus
margins
a
are tiny, right?
B2B. Margins are tiny. Yeah. No, it's a tough business. Like, alcohol is a tough business, but I think that was what was super cool is that I learned like a lot of things from mistakes. Whereas, yeah, I just think if I'd have gone out and played it safe and hadn't have taken a risk, hadn't backed myself, and try to go out and find a mentor, or try to put the puzzle pieces and see the picture before taking any
Mm.
action. I think in reality, and in my experience, like as I say, take this with a pinch of salt. I'm not trying to preach advice, but from my experience, it's just that's not really how you learn.
Mm-hmm.
But that was the one thing that I did learn is that, somewhere along the way, startups is sort of focused more on tech, UI, user experience. It's fundamentals of business. It's supply and demand. It's
Mm.
where are your customers and how can you find them? You've got to
Mm.
remove yourself and your ego and your own preconceptions of a market, and that's where you start. And that kind of
Mm.
brings us to Ollie, where in 2020 it was just very clear that there was this directional arrow of progress. There was this massive inflection point.
Mm.
It sucked that it was a pandemic and we were all living through a time where we thought that we all might die or never see our family again.
Yeah.
And it was obviously going to change and sort of correct course on a lot of
Mm.
behaviors. But the one thing that was kind of clear to me at the time was this idea of telehealth. Um, it kind of just made a lot more sense. It was something that I was excited about, to be honest,
Mm.
because I thought that, it was going to change. It was going to change like our relationship with health. And I think that's what we've needed. I think we've kind of kept health at an arm's length.
Mm.
You got a GP, they don't have any data about you. You don't
Yeah.
know, your health out of 10 right now. You don't know what that is. And
Mm.
that's what I slowly started becoming obsessed with trying to figure out.
That's an
And
interesting.
and yeah, that was it. That was it. That was the inflection point. Telehealth was going to be a big thing.
Mm.
I kind of scrapped together the first version of the app during the pandemic, like 16-hour days, the worst looking mobile app you've ever seen. Just terrible, very hacky, as
So
you do
what
with an MVP.
what was the MVP? What was in there? What was the initial kind of feature set?
Oh, it was basically you could book a telehealth session with, I mean, we had every healthcare practitioner you could think of. You could book a session with a chiropractor through a telehealth session on the app. I mean, I don't know why, but we just thought like these healthcare practitioners, they need to figure out a way to connect with patients.
Exactly. No one wanted to
Yeah,
go to a
like
doctor's office or room. Like,
you couldn't.
yeah,
You,
exactly.
you physically could not. Like
Yeah,
overnight, they saw their business model, I guess, completely change. What was like frustrating and what is frustrating about the healthcare industry is that it's very focused on like the tech and compliance, in the sense that everyone kind of waited to make the move to telehealth because they were trying to figure out, can we use Zoom, or what's the best video platform? Is it safe? Where I saw that the bigger problem was, you can pay for whatever video software you want, but it's about connecting with your patients. And if you don't have a way of connecting and generating patients, and they're not even going to know that you have this telehealth service. So that was the idea with the app. It was basically a marketplace. Anything from GPs to psychologists to biokineticists to gynecologists, you could basically book like a super cheap session, and it was half the price. So look, I mean, it was mid-pandemic. It blew up. Like, we got a lot of press coverage. We got lots of app downloads. We had these sessions coming in. We thought that we had hit that sweet spot of, wow, like we were right. Like this is happening quicker than we even anticipated, but we couldn't have been more wrong, because people would, especially in like the major cities, in Johannesburg and Cape Town, people would book one session and then that was it. So we naturally thought, this app sucks. It's terrible.
Yeah.
But what we saw is that, took a step back and we said, let's do the thing that you should always do, and that's pick up the phone and call your customer and ask them, like, what was your experience? What are you looking to do here? And that's what we did. We took 2 days, we WhatsApp, voice noted, we called, and what we figured out was, like, the experience was amazing. I mean, people were having these sessions in between being at work.
Yeah, exactly.
But the problem was that they couldn't afford the next session. Like, they would have a session with a psychologist, but they're struggling to pay like rent. Okay, like they've taken a 20% salary cut. I mean, it was the mid-pandemic.
Lost their job.
So like, lost their job. Having to do contract work. Things were uncertain. That was everyone's life. And that was when we started to uncover a couple of things, which I guess is the fun part about business, is that there was like 90% of our bookings were with psychologists, which we kind of just saw this demand for mental health, like nothing I've ever seen before. And then we got down to the real problem, is that there's a lot that gets said about the stigma. There's a lot that gets said about South Africans' perspective, our cultural attitude towards psychology and counseling. It's not that. The real barrier is the price. It's a top 1% luxury healthcare service. That's the real problem here, is that people need help. People want help. They're willing to get it. Can they afford it? Does it fit into their lifestyle budget? Most of the time, it doesn't. And that's when we kind of started working on creating our own currency, essentially a platform native way of changing the cost structure of therapy itself. And that's when we kind of came up with the credits, and sort of simultaneously we saw another interesting thing where companies were becoming globally distributed, and the talent pool is global, which means that if you're a South African, you got some good job. If you're in tech, you've got some job offers from Amsterdam companies, from US companies, if you want to handle that time zone. But that's a good thing, right? Because the talent
Global
opportunity
citizen.
opens up. Yeah, exactly. And that means that, in my perspective, I think South Africa's almost had, some South Africans haven't had that type of opportunity. Now they have. Now it's forced companies to really put HR at the front driving center of their company. It's about, if we want to retain our top talent, like, we got to do things the right way. So there's kind of this evolution in HR where it's gone from being more back office, admin, payroll, to being like, how do we onboard international employees? How do we build a remote distributed culture that's like high performance? So that's when we kind of had these two interceptions of like this demand for mental health and the need for companies to support their employees. And that's kind of when we joined together to say, well, like these mental health credits,
Yeah.
like companies are a customer.
Yeah. Can you explain the credit system and kind of how that fitted into your kind of growth strategy? Because I think it's fantastic because the credits are there, you give it to the employees, if I understand it correctly. And when they run out, it's kind of like, hey boss, I need a couple of more credits there. Just explain that if I've got the
Yeah.
concept correct and just how you've used that as a growth strategy to move Ollie versus what you learned at Quench.
Yeah, 100%. I mean, the the reality is like the flexibility is what matters most, and the fact that it's anonymous is what matters most. So the idea is that if you have a company, you get a company credit wallet, everyone gets access to basically that pool of credits, and it's like a
Okay.
savings account but for your company's mental health essentially. And that's super powerful because on the one side you get employees that they want to reach out and have these sessions because they need help, and it's fully anonymous from their team, number one, their company, number two, and what we've found most importantly from like your partner or your family. It turns out that like because it just shows up as another meeting in your calendar, it's not being claimed through anything. There's almost like no trail that you are like getting this
Oh,
advice,
that's interesting.
and that's especially among like male users. That's
Yeah.
quite an important thing.
Yeah, there's that
They
stigma,
just
right?
wanted, yeah, they just wanted to be anonymous, not only from their company but actually from like their partner or their family.
Mm,
I think it makes them more like willing to try it. And so that was the big thing. And then from the company perspective, why invest in your employees' mental health? To reduce burnout, to increase performance. That's obvious. But the problem, again, is the cost. Like every EAP program is charging a fortune per
mm,
employee, but the math doesn't add up because you're
mm.
paying per employee for something that less than 20% of your staff is using in
Actually
their
use,
case.
yeah.
So they're incentivized to, that invoice at the end of the month as a company keeps growing. Okay. But your usage, they're incentivized to decrease your usage. So that's
Mm,
the power of the credits, is that it's a pay per use, it's a
mm,
usage based model. It's at any month, your company is never paying for more credits than the staff need. And
yeah.
that's kind of the most powerful aspect of it, is like whenever you see that system in place, that's an opportunity to completely turn it
Mm,
on its head. And that's what we did with the credits. In terms of a growth perspective, it's powerful because I think what we didn't realize is that people become like quite emotionally attached to like having credits and their access to credits. And I think it's something that they almost like are incentivized to want to use, and they want to have credits. They want to gift
mm,
credits to a family
mm,
member. It almost becomes kind of like an asset in your life,
mm.
like a
So how did
small
you
thing that's impacting your lifestyle. That's kind of, yeah. I think that's a cool thing that we've seen happen from the
It's
employees and the
such a
users.
great concept, and I think what keeps going in my mind now is just like what you're doing is you're making sure that the company gets value. So as a company, you're actually making sure the company is getting full value for what they're paying for, and that's, I think, a great selling point. The question is, where did you see this model? Did you steal it from somewhere? Or how did you come up with it that you decided that let's try this approach versus what other kind of approaches are out there, those subscription models like you described?
Yeah, I think naturally I didn't realize, like in my experience in tech, I was being exposed to like a very specific type of supply and demand. And that was like a marketplace. It was,
Mm,
whether it was through Quench, there were consumers, and we were kind of the marketplace between like the bottle stores and the supply of demand. When I was working in Toronto, Canada, I was working, amongst in an accelerator with different startups, and most of them were like E2C marketplaces where there was kind of like a flow of transactions. Let me put it that way. Like,
mm,
this isn't a content platform. This isn't a media business. You're not selling software as a service. It's a transaction takes place. That's kind of like what I saw. But I think what it really like showed me is that companies like that, obviously the big two, let's use them as an example, Uber, Airbnb, we all use them.
yep.
They're the kingpin, they're built brand. In the beginning, when the behavior happens, right, you can call an Uber on your phone, one click, amazing. The user experience matters a lot when something's new, right? The same with telehealth. Like if you have the best and most simple way to do that thing,
Mm-hmm.
amazing. Like you'll win most of the market early on. But then what happens is as people start getting used to doing that behavior, booking an apartment, booking a car,
Yeah.
what happens then is the competition comes in, right? Then what happens is there's a price war, and your platform and your user experience matters less because there's more suppliers. Therefore, I can order Bolt instead of Uber Eats. I can get discounts on Booking.com, and what
Yeah.
that means is like it's quite scary because your retention and your customer loyalty declines. So our theory was if you had a currency on these platforms where instead of you paying cash for your Uber trips, you had an Uber wallet, it would incentivize you to lock yourself more into like choosing that platform to say, I want to, if I like earn rewards, I want them to be in Uber cash. It's that value of that one Uber cash or that one Ollie credit over time increases. Therefore, we retain you as a customer, and that was the thinking behind it. Because otherwise, what's your incentive to staying on that platform? I think that's the challenging thing, because user experience is important and solving the problems important, but I think it's deeper than that.
Yeah. So obviously, what I like about your kind of stories is that, Quench was an easy target, with in terms of finding customers. I mean, all students like to drink, and hence let's just connect the dots. And you started Ollie in a time when mental health really came to the forefront of people's lives because of what everyone was going through. So now that we're in 2023, like, how are you targeting? Do you feel like it's still easy to find your users, or are you doing, innovative ways to kind of, again, kill that stigma and say, hey, let's go on? Are you struggling to find people? And if you are, like, how are you trying to cross that barrier to find more people to join?
You've got to look for where your customers are, go there, hunt there, search there. Like that's how you got to do it. For us, it's like a little bit unique because when we started selling Ollie to companies, we had to like basically pitch why mental health is important. Like we're a lot further down in the market right now, where it's companies are coming to us because like legally they have to have mental health support, and they understand the importance. Now they're just looking for the right way to do it because they have a marketing team in Australia, and how do we cover all the regions. But like what we've always done is we've put aside our ideas about what we want to build, what tech we want to use. Your customers don't care about any of that. Like you got to go to your customers, you got to speak to them. Okay, cool. They're on LinkedIn, HR professionals. What's the movement there? There's lots of new HR communities now because it's transforming from HR to people operations. Okay,
Yeah.
opportunity. Now we're talking to someone more specific, because if you're trying to talk to everyone, you're talking to absolutely no one. And you've got to like understand who that exact person is. What problem are you solving for them? What do they need? Okay. What we do, we have this like principle where it's our principle for building product is one-click links. It's like we're optimizing for the shortest amount of time per transaction, which, by the way, I think a South African company has done that incredibly well, which doesn't get enough credit for. Maybe it does, but SnapScan, like their principle. I mean, they could have pivoted and added 15 features to SnapScan
To compete with Apple.
To compete with Apple, with Ozo, with the 15 million payment gateways that
There's a lot
for
of them, you're
some
right.
reason South Africa has, which I'll never understand, and I hope all get absorbed into Apple Pay. No, obviously Africa has its infrastructure problems with payments, so it makes sense. But that's our kind of thinking, because I think a lot of it, once you have customers, it's very easy to just bloat with features. We're actually seeing it now with Google. It's kind of unavoidable. Like once you get to a certain scale, you're trying to please so many different market sectors that you end up releasing like 15 new features. We're seeing it with Google Analytics, GA4, absolutely terrible. Like a lot of their products are becoming unusable because it's getting too complex. We're trying to be everything but that, because therapy is scary enough. So like it needs to be one-click links. And on the other side, if we're going to try something, it's got to be 10 to 20 people that we're calling or on WhatsApp. It's not research. It's let's talk to people and understand like what do they actually want? What can we try deliver to them before we've built it? Can we send a Stripe link? Can we get them to pay for it? They can pay for it. Okay, interesting. That means that it's real. It's a problem. Because you can talk to people and they can say, well, this is a pain point that would save me time. But if they have to load their credit card with debit card, if they're not going to do that, then there's no business there, right?
Yeah, what's the point? Yeah, that's kind of what we teach on the show. But Marc, what's your opinion on the rise of AI? Because now you can kind of get bots and you can start having conversations with AI around, you can ask questions and get, well, they are saying it's generic, but what is your view on the threat that AI is posing on the industry?
Yeah, I think if you're working in tech, there's a couple of things that are happening. Either you're trying to pivot to tech because it's hard to raise money right now. That's a bad idea. Don't like talking about sort of, inception points or inflection points. I don't like people jumping towards tech trends. I think it's much more valuable to follow human trends, like human behavioral changes. I think that's smarter. I get it. AI is going to change the structure of basically, like, we all have to understand that any piece of software that you use will have to have that sort of AI element, because otherwise you're going to feel like a 2001 PHP website.
But what about the mental health industry specifically when we talk about this? Like, do you feel like there's a threat for Ollie Health specifically with how people can ask ChatGPT, for example, for help?
I think, going back, AI should not be seen by anyone as a threat. It's going to play a role in how you deliver value to your customers and to your product. Like, we are going to have that Ollie AI anonymous bot for you. That's not meant to replace our product. That's something that if you want to have something where you can get quick anonymous advice, it's there. It's limited. The core of like where we find value on Ollie is the fact that these sessions are live. Like AI in many senses is going to contribute to, if we look at, SEM rush in 2 years' time, we start to look at search volume. I think something like AI anxiety is going to become a growing trend. People are anxious about losing their job. People are anxious about, what role AI play in my choosing of a career or not choosing of a career. In many senses, it's going to start to sort of increase the mental health pressures that we see. What are these mental health pressures? Isolation, loneliness, burnout, anxiety, social anxiety. I think what we're seeing is, those are the most kind of, I would say, search for reasons why people are wanting to have therapy. And I think a lot of it stems from the same core problem, is a lack of human connection, is a lack of relationships. It's a self-isolation where we're growing more inwards as we work online.
I've seen some scary graphs and stats around that. It's quite scary. Like, there was this graph I saw online about kids over time are just spending less and less time with their friends face to face. Like, it's bad. It's like falling off a cliff. It's quite scary.
I think we all know it and we can all feel it. I mean, things have changed. And I think the big problem is, like, our highest usage comes from students. It comes from, the bracket of 19 to 26. That's just the reality of it. Social anxiety, there's massive pressures. You've also got to understand that if you've just entered the workforce during a pandemic, you've never had the mimetic understanding of like inherently learning from people. You've been thrown into an environment where like you've been alone trying to figure it out versus trying to figure it out with other people. I'm not saying that remote work is destroying mental health. I think that's a false narrative. I think in many senses, it's allowing people to spend more time with their family, which is a positive thing. But
Mm-hmm.
we have to understand, if we're going to spend a majority of our day online, there's consequences to that,
Yeah.
and there's mental health consequences. And I
Mm-hmm.
think, like, what we actually selling in the customer value of Ollie, the credits are saving you money, but it's the human connection. You're talking to someone
Mm.
that's, giving you a 360 of your life to try and help you build better relationships and try become a better version of yourself. And I think we see that in the group pods as well. It's sort of not really even about what the therapist is talking about on these online group sessions. It's
Mm-hmm.
really about the fact that people are sharing stories with each other. Um, so I don't think AI is a threat. I mean, I guess it is to any tech product, but
Mm.
at the same time, like, if you keep delivering the value to your own customers, I don't think you need to jump at all of these sort of
Yeah.
threats or concerns, or
Mm.
overanalyze like what a competitor's doing. I just think it's an egotistical way of viewing your own business. Your business is not about you and your ideas of what it needs to be or what tech you should use. Your business is
Mm.
about them. It's about your customers.
Mm.
Like, and I think, yeah, I think as a founder, that's the most humbling thing, is that your business is not yourself. It's not your ideas of what it should be.
Mm.
So try drown out that noise as much as you can.
I like that. So, Mark, to finish, you clearly have an eye for gaps in the market, with your stories of Quench and Ollie. If you weren't pursuing Ollie Health right now, is there a trend that you are seeing out there that you would love to tackle if you had the capacity?
Oh, giving away free ideas. Okay, let's do it. There's a few. There's obvious ones. So I think that most people are becoming more proficient at, like, building a bit of side income, building some money online. Um, some simple Google Analytics is gone. There's definitely room there. So if you want to have a consultancy, you want to help people transition, most small business owners, e-commerce stores, they're not going to use GA4. They don't know how to use it. So I think there's an agency play there. There's a platform play there. Um, Build more simple analytics. That's a big shift. I
Mm-hmm.
think the world, we're seeing it. Most of our customers are global companies, but they have employees everywhere, and their biggest
Mm.
challenge, um,
Bringing it together.
visas. Like,
Oh, really?
the biggest
That's interesting.
opportunity in the world right now is the global movement of human. I mean, a passport and a visa is the new oil. The same way that if you were in mining or the oil and gas industry in the 60s, like, if you're in the visa, relocation, immigration, golden visas, you want to be either selling those visas, you want to be
People.
helping companies get remote work visas, digital nomad visas. Um,
So you
Anyone
see
in that
this,
industry right now
you
is going
see
to
that
make
trend
money.
continuing, eh? Even though obviously the pandemic, we'd like to say it's behind us, and there is a lot of talk about people going back to the office. Are you saying that that trend is not
Oh
actually the
no,
case?
no, those are no, no, no. No, look, those are the guys that are sort of at the helm of the big companies. Yeah, they have assets that they are invested in. They need people back at the office. Um, Most of the fastest growing companies that we have as clients, I mean, it's not even a question of, are we remote? Are we not remote? It's no, we want the best talent. Where's the best talent? It's in the Philippines? No, it's in Australia. Cool, get it done. Okay.
I
Let's
like that.
pay for their visas. Let's hire them. I don't give a shit where they work. If it's at an office, if it's at a coffee shop, it doesn't matter. They're going to execute. If they're the best for the job,
Yeah.
let's do it. What matters a lot for companies right now, where's our headquarters? Is it Dubai? There's benefits. Why? There's access to
Mm,
capital in Dubai. Okay. There's access to other benefits of talent there. Companies there can facilitate you getting that talent by supplying them with maybe it's a temporary visa, whatever it is. Like, because you've got to look at it as most people that are skilled, right? That are highly skilled
mm-hmm.
have higher opportunity to work for different companies or multiple companies at the same time.
Oof,
And
interesting.
ultimately, like, there is that flexibility. So people, if they can work from anywhere, they'll want to set themselves up in a place or country that's beneficial for them, whether that's
Yeah.
Dubai, Mauritius, whatever it is. So
Yeah.
I don't know. I think there's a huge opportunity there.
Yeah. No, I think you're right. I think going back to just what 2020 did to the working world and civilization in totality is we became more global overnight. And I like your idea because I definitely think there's legs there. You're right. It's more talent driven. It's not about where you're from. It's talent
And
driven. I
you
like that
know,
a lot.
and think about it like this for your podcast. I mean, are you threatened by AI? Of course not. AI is going to help you write out and transcribe this episode. You're going to have
Exactly.
someone outsourced in the UK that's really good at creating YouTube thumbnails.
Yeah.
That's exciting. Like, that's a good thing on both sides. And it
Mm,
shouldn't be like, oh, but we should like have an office in Four
yeah.
Ways or Stellenbosch. It's like, why?
Yeah, exactly. I like that a lot. Well, Mark, we've run out of time. It's been great chatting to you. Hopefully, we'll have you back on. But thanks for sharing your insights in how you're building Ollie and obviously your insights on these on other potentials. And I wish you all the best for the growth of Ollie. It sounds like you guys are doing fantastic work there.
Awesome. Thanks for having me on.
Cool.